Did you know around 1/3 of the world's population, that is approximately 2.4 billion people, suffers from untreated tooth decay? Oral hygiene is important not just for helping to keep your teeth white and breath fresh, but it's also essential to preventing serious gum and tooth issues, such as cavities. Poor oral health is also linked to an increased risk in cardiovascular disease and diabetes. Without even knowing it, we make everyday mistakes regarding the right care for our teeth. In this video we are showing you the common oral hygiene mistakes that you should correct for a good oral health. 1. Brushing too fast. Spending just 30 seconds on your teeth daily can hardly lead to a good result. It can cause cavities and other dental problems. You should spend at least 30 seconds on each of the 4 quadrants of the mouth, which is at least 2 minutes in total, and twice a day. Avoid brushing too quickly and too hard, as this can damage your gums and the enamel of your teeth. Brush slowly and gently. 2. Not flossing. Some people think that they have good oral hygiene because they brush their teeth every day. However, they may not be flossing nearly as often. Flossing helps to remove the bacteria that hides between your teeth and gums. Flossing at least once a day can help reduce the risk of tooth loss and periodontal disease. 3. Not changing your toothbrush. A toothbrush scrubs away a lot of bacteria, but there is a good chance that a lot of bacteria will be sticking to the bristles of an older toothbrush. Using an old toothbrush can do you more harm than good, since old bristles won't be as effective and might damage your gum if you're not careful. Normally, it's recommended that you change your toothbrush every 3 months, or when the bristles are visibly splaying outwards. 4. Brushing too soon after a meal. It's a common mistake to brush too soon just after we finished our meal. However, after a meal we often have acid sitting in our mouth, while our toothpastes are often made of abrasive materials, and when combined, acid and abrasives can erode and damage your tooth enamel. So, wait at least 15 to 20 minutes after meal, so your saliva can naturally break down the acid before you brush. 5. Not brushing the tongue. The tongue is often forgotten when brushing the teeth. Tongue is the biggest bacteria attractant in your mouth, and the bacteria on the tongue can transfer to your teeth and gums. So, when you brush your teeth, always remember to gently scrub your tongue as well. 6. Not drinking enough water. Believe it or not, but drinking water has a big impact on your oral health. Saliva contain minerals such as calcium and phosphate, which helps to defend tooth decay. Saliva also helps wash away food residues that may be hanging around on your teeth. Drinking water helps creating more bacteria fighting saliva in your mouth and prevent dry mouth. Dry mouth can result in the growth of bacteria and fungi, both of which can cause tooth decay and bad breath. 7. Avoiding the dentist. Seeing a dentist regularly ensures your teeth and mouth are healthy. If you wait until you feel pain to see the dentist, there's a strong likelihood that you're dealing with a serious issue, which could have been addressed effectively and less expensively much earlier. So, see your dentist for a regular checkup in every 6 months. If you find this video informative, give it a like and share with your friends. Subscribe the channel and turn on the notification bell so you never miss a new video. Here are some other videos you may like to watch. Thanks for watching.